There is a very well-known, let's call him a surgeon, so here's some tips that you can use in your area if you're trying to find someone qualified. These are not regulated. They are not recognized by the American Board of Medical Specialties. They are almost like a roundabout way to become a cosmetic surgeon. So if you come into my office, I can show you some photos that you wouldn't have normally seen on social media. And so it gives me hopefully more credibility that I know what I'm doing. You would think that my DMs would be filled with like inappropriate things, and sometimes they are, but I actually get a lot of questions about how to find a qualified provider. And I'm qualified, so you can fly and come to see me, and I know not everyone can. So here's some tips that you can use in your area if you're trying to find someone qualified. I'm Prem Tripathi. I'm a board certified facial plastic surgeon practicing in the San Francisco Bay Area. Let's talk about some things that I think will help you if you're looking for someone to work with. So the main thing about aesthetics and surgery and cosmetic procedures is that there is just a plethora of different options, different practices, different credentials. So it can be very hard to navigate the system, right? You might see PAs, nurses, RNs, nurse practitioners, physicians with different specialties. Everyone wants a little piece of the pie, which I get. This is a fun field. It's cash pay, so it does make money. But the thing is that when it comes to your face, my belief is that you really should go with someone who's experienced. And that experience comes in different forms. You want to make sure that this person is experienced with the safety portion of it, right? They're tasked with not only making sure that you look good, but also that it's done in a safe way, but also that they have the credentials to back it up. So that brings me to my first thing that you need to look at is credentials. Is this person board certified or not? And there are websites that you can go to, and I'll link them in the notes below, that actually tell you what board certification is for that person. So I'm board certified in both head and neck surgery and facial plastic surgery by the American Board of Facial Plastic and Reconstructive Surgery. That is public information. If you look me up on the ABFPRS website, it is widely available and you can see my name there. But the thing is that in the United States, anyone that is a physician that has finished 4 years of medical school, just the schooling portion, can get their license after 1 year of residency. They can get their license and it says physician and surgeon. So they can be a family practice doctor, a pediatrician, a psychiatrist, and still legally, by law, legally perform these types of treatments. Does it mean they're bad at it? Absolutely not. But it doesn't necessarily give you the credence that they've had the proper training or know the anatomy well enough to do it. You could take a weekend course and do it the next day. So I want you to just kind of be aware of that. It's super important to know. So by board certification, in my opinion, the specialties in medicine that are best at performing these treatments are plastic surgery, facial plastic surgery, oculoplastic, so any plastic surgery type procedure, not necessarily cosmetic surgery, but plastic surgery, clearly dermatology. These are the practices, these are the physicians that just do this the most. We know the anatomy, we've studied the anatomy, we spend years educating other people and learning at our conferences, so we just have the most up-to-date information and the knowledge base to build upon. So you definitely need the foundation. It doesn't mean that if you go to a family doctor, they're not going to do a great job. I mean, a lot of them do. But it just means that it's a little harder to navigate whether or not you know they're capable and how long they've been doing it. The other thing is that NPs and PAs that work under a great physician are going to do a great job. I get all of my injections from nurses that I work with. So it's not to say that you have to go to a physician. Nurse practitioners, RNs, and physician associates, which are PAs, are all trained to do these treatments. So that brings me to the next part, is the experience part. Is this person experienced in performing treatments? Have they been a nurse in a hospital for 7 years and now they just started doing this last week? Or have they actually learned to do aesthetic treatments and get the continued knowledge on this every single year for the last 5 to 10 years? That part's really important. In plastic surgery and facial plastic surgery, I was lucky enough to do fillers in residency and all throughout my fellowship, but I had colleagues that were facial plastic surgeons that went to academic medical centers and didn't have any exposure to it. So just being a surgeon doesn't necessarily give you the credentials. I mean, it's more likely, but it doesn't give you all of that. So you have to remember, you have to ask, and you should ask. There should be no secrecy when it comes to somebody's credentials or their experience level. The next, and arguably one of the most important, I mean, it is a little tricky, is their portfolio, right? In all likelihood, you're going to someone because you've seen their before and afters, but don't be shy to ask patients or ask your provider what the results could look like based on what they've had in other patients. So my patients that sign consents that say that I'm allowed to use their photos, some of them opt to only allow those photos to be used in the office. So if you come into my office, I can show you some photos that you wouldn't have normally seen on social media. And so it gives me hopefully more credibility that I know what I'm doing. As you should be able to ask about these treatments to your nurse or whoever is doing your treatments to make sure that they are the right person. So when it comes to plastic surgery procedures, however, this is even more important. So let's separate the aesthetic treatments like Botox fillers, microneedling to the surgical part now. So the only surgeons that should be doing any surgical treatment on your face are board certified plastic surgeons and board certified facial plastic surgeons and board certified oculoplastic surgeons. These are surgeons that have had the surgical training for 5 years in their respective residencies and then fellowships if needed. Cosmetic surgery is a board certification that you may have seen. That is not necessarily an adequate training. A surgeon can go to 5 years of general surgery residency and then get a cosmetic surgery training. These are not regulated. They are not recognized by the American Board of Medical Specialties. They are almost like a roundabout way to become a cosmetic surgeon. So I would not necessarily want my friends or family to go to a cosmetic surgeon. It just doesn't carry the same weight as a board certified plastic surgeon or facial plastic surgeon. So when it comes to surgery, you really have to be careful. Like I said before, could a family medicine doctor do an upper eyelid blepharoplasty on you in the office with local anesthesia? 1000%. Would it be legal? 1000%. Is it ethical? Probably not, because they probably didn't do any of those in residency and they weren't trained on how to manage the complications. Does that mean they'd be bad at it? No, but you can assume that a plastic surgeon would probably be very comfortable doing it and could manage any potential complications. So keep that in mind. Here's a bonus one for you. What's a red flag? A red flag would be when you go to this person's website that it's hard to find their credentials. And I see this all the time. There is a very well-known, let's call him a surgeon, that on his website, it is very difficult to find out what his specialty is. His specialty is actually in dermatology. He's not a surgeon, but because he had expert training after dermatology residency, he now does facial plastic surgery and calls himself a facial plastic surgeon. But there is not a chance that somebody like this could ever become a board certified facial plastic surgeon because the residency and fellowship training does not qualify him to even sit for the boards. Does he have great results? Absolutely. But it is hard to find his credentials. So it should not be hard to find someone's credentials immediately on their website. It should be readily apparent, not hidden, because the only people that want to hide it are people that want to hide it from you, right? So that is like a huge red flag for me when I can't find it out, what their credentials are, and I have to hunt for it. Because if I have to hunt for it, that means there's no chance the average person that doesn't know all of these, all the nuances is going to figure it out. So to summarize, if you're looking for a plastic surgeon in your area, somebody that you can trust, remember that their specialty matters. So they could be a board certified plastic surgeon, which is a surgeon trained to treat the face and the body, a board certified facial plastic surgeon for the face, and a board certified oculoplastic surgeon for the eyes. Cosmetic surgery is not a recognized board, and neither is other subspecialties within other subspecialties. Dermatologists are great. They're trained to treat non-surgical, treatments for the skin and face and for the body, but they are not surgeons, which is fine because surgery patients should go to surgeons and derm patients should go to dermatologists. I send patients to dermatologists all the time. Keep those in mind and remember that it should not be hard to find that person's credentials. It should be the tip-top, most basic thing that you should know about them, bare minimum before you move on to looking at their portfolio. If you like this type of content, like, subscribe, follow for more. I'll see you guys next time.